Hi everyone, my name is Jānis Slezins. I am board certified neurosurgeon based in Riga, Latvia. I have started my neurosurgical career in 2006 when I started neurosurgical training immediately after finishing medical school. And since 2012 I'm working as a specialist in neurosurgery. Most of the time I have spent working in Latvia, but I have a couple of years experience of practicing neurosurgery in UK. So today I want to share a small story about one of my patients with you and use this story as an example of one of the diseases that I want to discuss with you and explain the concepts of this disease to you. So a couple of weeks ago I had a clinic and 41-year-old woman appeared in my clinic. As we started to discuss, she started to explain me her symptoms. She was saying that I have some pain in my shoulder, in shoulder blade. This pain radiates down to my arm. I also have some pins and needles, and I also feel like my arm is kind of weaker. Prior to seeing me, she has seen orthopedic surgeon, and she was examined for having any kind of shoulder joint problem, but orthopedic surgeon reassured her that there was no any kind of shoulder problem. And indeed, I tried to move her shoulder joint and it was moving freely, and it seemed that these symptoms are not any kind of related to movement in shoulder joint. So what else could it be? And since she has symptoms that suggest involvement of the nerves in the disease, which are numbness, pins and needles, I also examined power in her arms and I noticed weakness on the left side biceps muscle strength, which is in line with C6 nerve root, which comes out of the neck. And I referred this woman to MRI scan of cervical part of spine just to confirm this. 1 week later she came for follow-up appointment, and it indeed proved left-sided disc herniation in neck. So it's very similar disease to lumbar disc herniation in lumbar part of the spine. The only difference is that nerve roots that are exiting spine in cervical part are radiating or going to arm. Therefore, compression to nerve roots in cervical spine cause typical pain, which is called like brachialgia or radicular arm pain. Similar to lumbar disc herniation, it's very important to understand when was the onset of the disease. If the onset was quite recently, let's say 1 or 2 weeks ago, there is still a good chance for this disc herniation to reabsorb or shrink and by shrinking it takes the pressure from nerve root away, and by doing that patient recovers. And this should happen within 6 to 8 weeks. So if patient appears to my office and is reporting typical symptoms and MRI confirms cervical disc herniation, if he or she doesn't have any indications for immediate surgery, then we can wait for 6 to 8 months and treat patient with conservative measures. So, by the way, conservative measures, none of them are able to treat the disc herniation. We can use pain medication mainly just to improve patient's pain, improve his or her comfort, but there is no medication that actually causes disc herniation to shrink. It will happen on its own, or it will not happen. If disc herniation has not reabsorbed, after 6 to 8 weeks, patient is still having symptoms, or he or she has appeared to doctor's office already with months of history, this patient needs to be considered for surgical intervention. The most typical surgical intervention for disc herniation at cervical spine is so-called ACDF. ACDF stands for anterior cervical discectomy And fusion, as name already states, it is a surgery with anterior approach, which is done under general anesthetic. This surgery is quite minimally invasive. It is very gentle and therefore it's easy to be tolerated. The ACDF surgery is most typical surgery to solve a problem of disc herniation in cervical spine. However, depending on specific situations, there can be other surgeries used, for example, foraminotomy from posterior approach. However, in this video we will discuss the most typical situation and ACDF surgery. Disc herniation is being taken out and disc is being replaced with either so-called cage implant or artificial disc. Surgery is quite easy to be tolerated. Most of the patients have some mild pain at surgical site after surgery, and some of them have some difficulties to swallow. So we discharge these patients on the first day after surgery with typical recommendations to wear a cervical brace, rigid or semi-rigid, for a couple of weeks, which contributes to healing and pain control and comfort. And then patients can transition to soft collar for a couple of months. And we also recommend some pain medicine as required. The typical follow-up with surgeon in these cases are in 2 to 3 months with X-rays, just to evaluate the position of the implant. So as a summary to this video, cervical disc herniation is quite common disease which presents typically with symptoms of brachialgia or radicular arm pain. Initially it's being treated conservatively, and if conservative treatment fails to improve symptoms within 6 to 8 weeks, surgical intervention should be considered.